one came from an anonymous attendee. I'm assuming that it will be for Mandy rather. The question is, what about carbon dioxide being breathed back in while wearing a mask? So Mandy, do you want to come in?
Sure, that's a good question, and I know there have been some circulating stories around that. Essentially, the carbon dioxide is much, much smaller than the droplets that are going to be carrying the virus and will simply pass through the mask. If we think about surgeons, they've been wearing surgical masks, which used to be cloth masks, for many, many decades, if not hundreds of years, and we certainly wouldn't be happy if surgeons became overcome with carbon dioxide and became what we call hypercapnic, which would mean that they'd become a little bit disoriented and dizzy. So there really is no reason to believe that any children or adults will be affected by carbon dioxide. Remember also in my presentation, I spoke about how much your breath comes out, and when you wear a mask, it still leaks out the back and the top. The only way is for one to wear a huge mask, as you would see firemen wearing, so in order to stop any of that type of leakage. So even with the healthcare workers who are wearing the respirator masks and so on, if they were going to be exposed to any dangerous gases, they wouldn't be able to use those to stop inhaling the gases because it simply goes through. So I think you can be quite assured that it's not going to cause a problem.
Thank you. That's a lovely, clear answer. Next question. I think we have two questions that are around staff with or people with comorbidities. So I'm going to read both of them. First one says, will removing those with comorbidities from schools make a real difference? This is really difficult. This is a really difficult decision for families as it isolates children and creates even more stress at this time. Also, educators have highly developed senses of responsibility, and it is very difficult to stay at home if it really doesn't mean anything. The question around that, and then another one that was directed specifically to Batandwa. How did Mr. Sunamzi handle staff with comorbidities? So Batandwa, maybe I'll let you go first with this one.
So I shall answer the one that is directed to me. And I guess that I don't have the answer for the first two.
Yeah.
Yeah, thanks for the question. What I've done is I said I've supported them to put together the application. The procedure is, which has been given by the department. They must go to their doctors and ask for a medical report, medical history. Their doctors would write the medical history of the teachers to say that this condition started this year, it has been, the patient has been seeing the doctor, whatever it is. Then that report gets submitted to the principal, who must recommend a leave. So what I've done in my case with the 3 colleagues, I've advised them to see their doctors. They went to their doctors, they got the medical report, helped them fill in a form that the department has designed, and I recommended, I just wrote a recommendation to say I support their application and submitted to the department, to my circuit manager. Now the next step would be now the department to respond whether the leave is granted or not granted. If it's declined, then we shall take it up from there. That's how I dealt with staff with comorbidities. Do I have another question?
So I'm going to just give Mandy a chance to maybe respond from a more scientific perspective to the first question around comorbidities. Mandy?
Thank you, Magali. Yes, so I think if I can answer this in 2 ways. The first is to talk about children with comorbidities, and then to talk about staff with comorbidities. I'm not really sure which one is intended in this question, but looking at the second part of it, it possibly is both. So for children with comorbidities, Again, if any children have any significant diseases that cause them to be immunocompromised, one should chat to whoever is responsible for looking after them in terms of the doctor and advise what is best. Because when you balance the benefits versus the harms of going to school with all your friends or staying at home, it might well be that that healthcare professional says that if they're well controlled, they should go to school anyway. And just to say at this point that well-controlled asthma, well-controlled allergies, despite being respiratory conditions, are not reasons for children not to come to school. When it comes to the educators who have a highly developed sense of responsibility, I'm assuming this is educators who have comorbidities, who might not want to stay at home. I think this is where it becomes individualized, and as Mr. Batandwa said, it's up to that staff member to speak to their treating doctor and determine what is best for them. There are things that can be done as far as possible to reduce their risk, possibly by wearing shields, medical masks, etc. So it might be that if somebody has made that decision for themselves, they are able to come to school, but obviously it needs to be documented so that that decision hasn't been forced upon them to attend to school. I'm not sure if I've captured everything that that question asks, but I do hope so.
I think that was helpful. Thank you, Nandi. I'm going to move on to another specific question where I'll let you also respond. Question by Ilona Herman, who's the principal of a special needs school. She says, we've been hearing about COVID-19 for about 6 months now. But is there anything out there on the management of children with severe intellectual disability returning to school? We'd love to have them all return, but unsure of the high risk that some of them may present due to their inability to understand social distancing, wearing masks, etc. I don't know if you have any advice on that, Mandy.
Ilona, thank you so much for that question. It's a very pertinent question. We too would love all of these children to be able to come back to school, and I know that many families would really like that as well. I've been working with a pediatrician from Red Cross Hospital around this area. It's been very neglected, and we are trying to develop some checkpoints, checklists that can be used in that specific setting, because obviously we have very grave concerns that it's just not going to be possible for social distancing to be carried out in terms of the needs of the children, and we don't want to put staff or other children at risk. And again, that is why it is so important for us to monitor the schools as they open and to get some studies up and running so we can really answer this question: are children likely to transmit the virus or not in the school setting? And that will really help us determine what we should do in these specific settings. But there is something being done about it, but unfortunately, as in so many of these situations, it hasn't been prioritized, but there are people working on it. And I'm not sure what area Ilona is in. I know that's true for the Western Cape. I do know at certainly Department of Health is on their radar, but how much has actually been done at this stage, I can't say.
Yeah, thank you. So Ilona, you will get the contact details of Nandi as well if you want to make direct contact with her to ask for some of those details, and maybe that's something you can take offline. I do think it's an interesting question. We have a question here which I know is on many principals' minds. If a staff member or many staff members are tested positive at a school, and the rest of the staff has been in regular and prolonged contact, what happens then? So I'm assuming that there's a scientific response to that, and then there's a maybe bureaucratic response to that. But maybe Nandi, you want to quickly give your perspective on that, and then maybe we can hear from Batandwa as well if he wants to add.
Sure. So it's quite simple in that we divide contacts into close contacts and casual contacts. And a close contact is defined by the National Institute of Communicable Diseases as being in face-to-face contact with someone in less than a meter space, or to be in a closed space with someone who is positive for more than 15 minutes. So what we would say is that if the school has structured itself adequately to reduce transmission, then staff members should be maintaining that physical distance from each other, not dropping their guard when they're going to the staff room and share lunch and so on, but that the physical distancing is maintained in the staff room. And so thereby you wouldn't be considered a close contact. If there's going to be a situation where you're all in a small room, as long as you're wearing masks and are sitting more than 1.5 meters away from each other, you would not actually be considered close contacts. But this is where it becomes important. If there is a discussion, like if there's a situation like this, it's important to have a discussion with the supporting healthcare facility or provider for each school. That's the ideal. We're advocating very strongly for the return of school health services in a more coherent, intersectoral manner, and driven by the fact that we've seen we need this coming out of the COVID experience. So I'm aware that not all schools will necessarily be able to contact somebody from the public health services immediately, but do try within your school environment to identify who you can call in your area. The DBE does have the contacts at the back. I know that they won't always be able to respond immediately, which is why I'm saying it's not always going to be possible to do so. But by and large, if the school has set itself up, you should not be a close contact. You should be a casual contact of another staff member. And that would mean that you don't actually have to quarantine and stop going to school to teach.
Thank you, Mandy. Batandwa, anything from you?
No, I think she has covered everything. I think she has covered everything. I can just take another question.
Yeah. So a question for you then, Batandwa, from Esmeralda Zarafa. She asks, have children been wearing both a shield and masks? And also, are you using gloves at all?
No. Yes, the children have been wearing masks since they came, and we are advising them to keep the mask all the time, not unless they are eating or drinking water. We are not using gloves. We've got I think the scientific recommendation that if we use hand sanitizer, it's fine. Every morning before they come in, the cleaning staff comes in, and the teacher in class, and they wipe the surfaces with some chemicals and jig. And when they get in the class, they sanitize, and when they leave the class, they sanitize, and then when they go home. So we're not using gloves at all. All right.
Yeah.
Any other question?
Yeah, we have a question. I don't know if we have a good answer for that one, but I'm going to try and let you decide. What are the new leave regulations for teaching staff during this pandemic? This is from Claire Tompkins.
Yeah, as I said earlier on, the only new regulation is for those who would apply for special leave. It's a special leave. It's called a special leave. I can share that with them. I don't have it now in front of me, but there is guidelines with regard to that. However, teachers, when they feel sick, they are advised to stay home. But if it's getting worse, they must see their medical doctors or GPs. And if they are booked off, they can still use their normal sick leave. It's still in operation. For COVID-19 confirmed case of teachers who tested positive, there is a new regulation that came out, I think it was yesterday or last week, which gives also guidelines of what needs to be done. You submit the doctor's certificate, fill in the leave form, indicate that this teacher has tested positive and he has to be quarantined for 14 days. If you need a substitute, you apply for that. I think they have approved that now. You can apply for a substitute. Otherwise, they say the leave regulations that have been there are still intact, except that now if one has got an underlying condition and the person is older than 60 years and the person wants to apply to work from home, or the other thing I forgot is that you must have a plan to work from home. Submitted with your doctor's medical history and the form and the principal's recommendation.
So
I can provide more information to Ms. Claire's question. If she's got my number, you can give her my number or my email address. I will send her all the information.
Yeah, thank you so much. Maybe what we'll try to do is get that information also and circulate it with the recording, so that it's available for everyone.
I will do that.
The next question from Leanne Kaplan: how will you maintain 15 children per classroom when all grades return? I think that question is on many principals' minds.
Yes. We have decided on alternate days model. What does that mean? It means because we will have a problem with space when all the grades eventually return. What we are doing now, planning for grade 6, the group of the cohort of learners that is coming on the 6th of July. We are going to have grade 1s, grade 3s attending on day 1, and then day 2 we alternate. We have other grades attending in order to manage the space. We have grouped them, of course, to maintain the social distances. In each class, I will be putting 20 learners. We were doing that today, calculating and all that stuff. If people would want, especially principals, need to share this model, I can always make it available for them.
Yeah, I see there's a number of questions coming through around timetabling, you know, how timetable is developed.
That's difficult,
that kind of thing. So I think it might be a good idea to start to share some of the things that you've put in place, and maybe Nandi, you have also some practical examples that you might have been exposed to that you might want to share. Let me just give Nandi a chance.
Magali, I think the people in this room are those who are going to be providing that. And you know what we don't have? We have all of these principle-based approaches and then the guidance, but what is missing from the DBE standard operating procedures are some examples, some workable examples. And I don't know how you interface or relate to the DBE, but I'm just wondering, is there anywhere, or perhaps you do post it on your web pages as well, but is there any way one might be able to collate this collective experience from your groups here and put a couple of pages together? I think it would be so helpful for sharing more widely, because different experiences, different constraints, different solutions will be extremely helpful for many, many schools in this particular situation right now. So, I mean, I just think in terms of Batandwa's comments and his experience, just if one could capture some of that, it would be hugely useful, and we could try and get it to DBE and maybe link it. So these are examples of how you actually practically operationalize the SOPs as a thought. I don't have any, I'm relying on the expertise in this room to really give us those examples, the worked on the ground examples.
Thank you, absolutely. So Nandi, I'm just going to use the opportunity now to just also refer to the fact that we have a little knowledge management team at Symphonia, and we have a knowledge sharing platform that we use and that is open for all the PFP principals. So we're going to try and collect some of that knowledge and some of that some of those, the wisdom that comes from experience, you know, from our various principals, and make that available at least within our network. And then indeed, we might just want to liaise with you about making that available to a broader audience as well. So thank you for the suggestion. Sure. So many questions. Yeah.
Can I just come in here? I think Principals Academy, I'm also part of Principals Academy, and I've got wonderful coaches there, well-experienced principals. They have a draft document for discussion which assists us as schools for these alternate days options with scenarios for both high schools and primary schools. With their permission, I think we can share that, seeing that indeed the DBE doesn't have any examples or templates that teachers can follow, principals can follow. But I can also share that if Principals Academy allows me to do so.
That would be amazing. Thank you, Batandwa. That's definitely something we'll follow up on. So we'll take that offline and we'll try to get our hands on that. Thank you so much for doing that.
Magali, if I can just say in the college guidance at the back of it is a structure about how you can stagger your cues to fit more kids in the same length. And that's really important because I'm so worried about all of these kids in the cold waiting to be screened before they come into the schools. And as more kids come back to school, it's going to slow things down a little bit. I mean, you can only have so many people actually doing the screening. So there's some very practical steps that can be taken. And I think in terms of how you spatially arrange desks and how you spatially arrange children to fit more into spaces. So those are the kind of things would be lovely to see shared.
Yeah, absolutely. And I must say I was very impressed by how simple this staggering of cues principle is, but you don't think of it until you see it. So we're going to share that document from the College of Medicine also with everyone on the webinar today. So please don't panic. For those who are in the audience, if you haven't seen it, we'll make it available. We'll share that in the email. I'm going to move to another question. Shame, I see there's lots of questions coming in. I don't think we're going to have time for all the questions. But there's a question here from an anonymous attendee. Is HIV one of the comorbidities in children? Can they attend school? What is their risk? Mandy, do you want to come in here?
I mean, that's a very good question. Yes, it is. But it would be a child who has HIV and has a low CD4 count, so who isn't well controlled on their medication. And so in that particular case, they need to discuss it with the treating doctor, the treating facility, just to make sure. So if their viral load and everything else is under control, they certainly can come to school. What is their risk in terms of actually developing the disease, or contracting and then developing it? We're a little bit less certain of that. Certainly in adults, we're starting to see that HIV is one of the contributing comorbidities, but we don't know how much it actually increases your risk. But certainly a child who's on medication can go to school.
So I'm sure that's very reassuring to hear. Thank you for that. We have a question here, again, anonymous. To Batandwa. Batandwa, can you please? Oh no, sorry. Sorry, sorry, I'm getting confused between my questions. Derek Majosi is saying, I was impressed by your presentation. Can you elaborate on the subcommittees you formed and the COVID-19 committee? Batandwa?
Okay. Elaborate more on the committees that we formed.
Yeah.
We have formed one committee which is called COVID-19 task team, which is composed of the principal, 2 SMT members, 5 staff members. Amongst the 5 staff members, 1 is elected as the COVID-19 compliance officer. He makes observation and gives reports on a daily basis to the principal, and on Fridays we sit together and give report and feedback of our observations. How have we been complying with the regulations of COVID-19? We also have a representative of the SGP in the committee. We also have the non-teaching staff members are represented in the committee. So that's how the committee is formulated. I'm not sure whether that sufficient, that gives sufficient.
Was about subcommittees, whether you have subcommittees.
No, we don't have subcommittees.
All right, thank you. We have a question here from Kozanai Kubiko. I hope I'm pronouncing that correctly. From Sunrise Super Kids Primary School in Mokopane. Wow, school in Limpopo. From a scientific point of view, may you comment, please, if it is recommended for learners to put on face shields instead of face masks? The same with the teachers as well, since it is difficult to teach with a mask because some learners understand better when they read your lips when talking, and the facial expressions from the teacher as well, like that little smile will motivate a child. It is difficult to read emotions inside the face mask. So that's an interesting one.
Well, I have to say the questions on this forum are spot on to the scientists right now. We don't know is the truthful answer. What is shield or a mask? They both have their advantages and disadvantages. What we have suggested is that teachers wear visors wherever possible, wherever those are available. And this was really as an additional prevention, being adults, so that their eyes were protected. But pragmatically, what we've seen in the last 2 weeks is that teachers are putting their visors on and then, without touching the front of the mask, pulling their mask down, keeping it around their neck, and teaching without it, so that all of these interactions can still be picked up by the kids. When it comes to the kids wearing visors, some schools are allowing it, but it must be then in combination with the mask. I think, you know, one does take a while, a couple of days, to get used to wearing a mask for a certain duration of time. So I think that must be promoted first, and then the visors are an add-on. With the little kids, though, there are some ingenious designs coming up with plastic attached to little sun hats so that those will stay on. In time, we might see more of these coming out. But yeah, I would say that a teacher who is standing adequately far away from the kids in the front of the class, and just to say that we are suggesting that teachers don't walk around the class to look at the work, but they actually stay in the front of the class. I realize that might bring in some discipline issues, but in terms of their protection, it's very important that they don't move around the class too much. But if they are standing in front of the class and they have their visor on, they are able to take their mask down. Remember, from a visor, all of your droplets are going to go front onto the visor and then dribble down onto your desk or onto the front of you. So as long as that desk is cleaned afterwards, it should be fine.
But Tandwa, do you want to add something?
No, I think it's covered. Yeah, it's covered.
Okay. All right. So we have an interesting question here. What courses are available for schools to be COVID-19 ready? What organizations are offering these courses that can come into schools to do these courses, not webinars? So obviously you've mentioned Life Choices, but Tandwa,
yes.
I'm sure a lot of principals wish they could also, you know, reach out to Life Choices. So we can maybe share that as an option. Are you aware of any more organizations that come to schools?
No, at the moment, I only know Life Choices. I'm happy to share their contacts, and they can speak with the director, Ms. Sophia Niels. I'll share the information with Gonzalo.
Wonderful, thank you. Mandy, anything that you might be able to add?
No, that's fine.
Okay. We have another question here, again, anonymous attendee. DBE talks about adults over 60 as being high risk. A lot of the recent statistics show that there have been high fatalities in the 50 to 60 age group. Various people, like Nick Taylor, have suggested that people over 55 are high risk. So what ages are higher risk? Mandy, I think that would be for you.
Yeah.
Yes, so I mean, I think there's risk, and then there's what the DBE suggests. So every day our risk increases as we get a little bit older. It seems that age is an independent predictor, even more important than other comorbidities. Where do you draw the line? There certainly have been fatalities in the 50 to 60 age group. I will say at the moment, although it seems like there are a lot of deaths, over 1,000 now, it is still difficult to extrapolate from those deaths exactly what the key factors are in terms of driving those deaths. So it seems at the moment that we're not totally reflecting what's happened in countries in Europe, for instance, but it's very early for us to make those determinations. Having said that, we also have a much younger population, so we are expecting to see high fatalities in those groups compared to what was seen proportionally overseas. So there are two things going on here. The one is that the data is quite early, and the other is that our demographic, our population distribution, and that we have a much younger population compared to, say, North America and Europe, where there are many, many more older people who were all dying. So I think this is a very difficult question to answer. DBE is saying 60 as being high risk, but particularly if you're less than 60 and you have comorbidities, you need to discuss that with your treating doctor. And I think that ultimately, life is not without risk, and we all know that the older we get, the closer to death we are, and so we just need to take this step by step. And at the moment, what we've learned from elsewhere is that 60 is a reasonable threshold. In time, that might change, but that's what we're working on right now.
Thank you, Mandy. We're going to have to get to the end of the questions now because the time is running. So maybe what I can do, I'm going to take one more question, but in the meantime, also encourage the attendees to check on your chat. There's a message from Nanhlanhla with a link, and that's a link to the feedback form. So if you can find that link, I know it can take a few minutes for some people to orientate themselves, but click on the link if you can, or copy paste it into your browser, and you will be directed to a Google form that asks for your feedback on the session. So I'm going to encourage you to go and give your feedback so that we know what we did right and what we need to improve for next time. In the meantime, while you are doing that, I'm going to just give one more question from Lidl Bota in Limpopo. Her question is, please share your model for alternate days schedule for when more people return in July. I suppose we've covered it actually, Batandwa. We said we're going to try and...
I've already sent Mr. Page, Salvin, I've emailed it to him now.
I see a question here on the chat. I'm from the Department of Education, confronted by a process of assisting a colleague with comorbidity, I suppose it should read. Then what relevant forms need to be used? Is it in terms of applying for special leave? I'm not sure what the question is about.
What's the question again? I can't see it here.
Yeah, the question is on the chat. It says, I'm from Gauteng Department of Education, confronted by a process of assisting a colleague with it says comorbidity. I'm assuming it might be comorbidity. Mm-hmm. Then what relevant forms need to be used? Please share the forms. So what we'll do is maybe we'll share, we'll try to get the most relevant forms and documents and guidelines, and we'll share that on our knowledge sharing platform, and we'll make the link available to our PFP network at least. And whoever posed the question, I can't see the name, maybe just contact us offline to see that we can get those forms to you as well.